They won't bring this up during your typical doctor's appointment. But let's speak honestly. If you stop engaging in solo sexual activity as you've gotten older, your body might already be experiencing effects you're unaware of. This isn't about taboos or myths. It's grounded in real medical science. I'm Dr. Carmel J. Johnson, a urologist and men's health expert with over 20 years of experience helping aging adults maintain vitality, health, and confidence. And one truth I've seen time and again is this. Many older adults neglect their sexual health, and by doing so, they unknowingly affect their overall wellness. What many don't realize is that sexual activity, including masturbation, isn't just a youthful habit. It's actually a natural, beneficial function that helps regulate hormones, improve brain function, support heart health, protect the prostate, enhance sleep, and even boost your immune system. If you stopped or never began this part of your self-care routine, the hidden impact might be greater than you imagine. In the next few minutes, I'll explain exactly what happens in your body when you stop masturbating in later years. This information could reshape the way you understand aging and health, and how you care for yourself moving forward. If staying mentally sharp, physically strong, and emotionally balanced matters to you, make sure you subscribe and turn on notifications. And if this message speaks to you, drop a 1 in the comments. If it doesn't, feel free to type 0. Your response helps guide the kind of content I create for you. Now, let's begin with one of the most overlooked consequences of stopping, what it silently does to your prostate and urinary health. 1. Declining prostate health and urinary challenges. When I started practicing urology over 20 years ago, I never expected so many older men to quietly confess that they had stopped paying attention to their sexual health. One patient in particular stands out. He was in his early 70s, sharp, active, and relatively healthy. But he told me, "Doc, I just thought I didn't need that part of my life anymore." He came to me because he was waking up 4 or 5 times each night to urinate. What he didn't realize, and what many men still don't know, is that regular ejaculation, even through masturbation, plays a significant role in supporting prostate health. The prostate is not just a passive organ. It's an active, fluid-producing gland that needs regular movement. When there's no release, the fluid can become stagnant. Over time, that stagnation can cause inflammation and swelling. This leads to symptoms like frequent urination, a weak stream, and a constant feeling of bladder fullness. These are early warning signs, not just minor inconveniences. If ignored, this kind of chronic congestion can lead to more serious conditions like benign prostatic hyperplasia, BPH, which affects nearly half of men over 60. If left untreated, it may even result in urinary retention, infections, or the need for catheterization. Sadly, that same patient eventually needed surgery to relieve the pressure, something that might have been prevented through consistent, natural habits. Research has shown that men who ejaculate more than 21 times per month have a significantly lower risk of developing prostate cancer. This isn't about chasing youth or being obsessed with sex. It's about maintaining biological function and preventing problems. When older adults stop masturbating, they're not just giving up a form of pleasure. They may be giving up an easy and effective way to care for their prostate. I've seen once independent men lose their confidence and freedom because they're constantly worried about finding a bathroom or waking up all night. And the impact isn't just physical. It affects their emotional health, their confidence, and their ability to live freely. 2. Mental fog and declining cognitive clarity. What starts in the prostate often doesn't stay there. I've had patients who didn't complain about physical issues, but came in feeling mentally off. One man in his late 70s told me, "Doc, I just don't feel like myself. I forget things. I lose focus. I used to be sharp." Yes, aging can bring natural changes in memory and mental clarity. But what many people don't realize is that sexual activity, including solo activity, helps protect the brain. When you engage in masturbation, your brain releases important neurochemicals like dopamine, serotonin, and oxytocin. These aren't just feel-good chemicals. They actually help protect brain cells, improve blood flow to the brain, regulate mood, and support memory and focus. Without regular stimulation, your brain misses out on those benefits. Over time, this can lead to mental sluggishness, difficulty concentrating, and even emotional flatness. It often starts subtly, forgetting names, or misplacing things. But if ignored, it can lead to deeper issues like anxiety, low motivation, or even depression. In men, there's also a hormonal connection. Testosterone, a key hormone for mental sharpness and emotional stability, can decline more quickly when sexual activity stops. This isn't just about libido. It's about identity, clarity, and drive. Some studies now even suggest a link between a lack of sexual activity in older adults and early signs of cognitive decline, including dementia. Now, I'm not saying that stopping masturbation causes Alzheimer's, but here's what I am saying. When the brain is cut off from stimulation, emotional release, and natural hormone balance, it becomes more fragile. It loses its rhythm. It loses its strength. And over time, that loss can quietly affect the way you think, feel, relate to others, and even how you see yourself. One man told me he stopped going to his chess club because he couldn't concentrate anymore. Another, a retired teacher, said his mornings felt blank, like nothing was waiting for him. These weren't issues that required medication. They were signs of a deeper disconnect, from their own bodies, from intimacy, even the kind that comes from within. The saddest part? This kind of decline is often preventable. You don't always need expensive medications or complicated treatments. Sometimes it starts by simply reconnecting with your body, listening to what it needs and honoring that connection. Because when the body is activated, the brain wakes up too. But losing mental sharpness is only one piece of the puzzle. The next one is quieter, harder to explain, and often more dangerous. What happens to your emotions when you stop engaging with yourself intimately? 3. Increased risk of depression and emotional numbness. I remember a man in his early 70s, a widower, healthy, retired. He sat across from me and said something I'll never forget. I don't feel anything anymore. Not sadness, not joy, just flat. He looked at me and asked, asterisk, is that normal for someone my age? That question broke my heart, because I hear versions of it far too often. Many older adults think emotional dullness is just a normal part of aging, but more often than not, it's a symptom of something deeper, something that can be addressed. One major, overlooked cause? The loss of sexual stimulation, particularly self-pleasure. You see, masturbation is not just a physical act. It's a powerful emotional release. It's your body's built-in stress relief tool. During climax, your brain releases chemicals like oxytocin and endorphins, natural mood boosters that calm anxiety, ease tension, and lift your spirits. When that release disappears, especially during tough times like grief, loneliness, or aging, you may slowly start to feel numb, and that numbness can quietly turn into depression. I've seen it happen many times. Someone stops touching themselves after losing a partner, or because they think, I'm too old for that now. Weeks pass, then months. They withdraw. They lose interest in things they once loved. Conversations dry up. Sleep and appetite change. Life starts to feel colorless. The tragedy is, they don't connect the dots. They think it's just old age or personal failure. But often, what they've really lost is the simple act of connecting with themselves, not for lust, but for emotional survival. Depression in older adults is often missed because it doesn't always look like sadness. It can show up as tiredness, irritability, lack of motivation, or emotional emptiness. And while medication and therapy are absolutely important, I've helped many patients improve their well-being by simply encouraging them to reclaim self-intimacy. One man later told me, I feel alive again. I didn't realize how disconnected I'd become. That small change reminded him he was still human, not just someone waiting for life to end, but someone still living it. And that's what I want you to understand. Masturbation in later life isn't about fantasy. It's not about shame or indulgence. It's about emotional health. It's about giving your body a reason to feel, to release, to remember what it means to be fully present. Because when you lose that connection, you're not just risking sadness. You're risking isolation, emotional shutdown, and sometimes the quiet fading of the will to live fully. But it's not just your emotions that suffer. As the nights grow longer and your sleep gets worse, there's another hidden cost, one that can affect your memory, your immune system, and even your risk of serious illness. Let's talk about how the lack of sexual release may be quietly stealing the deep, healing sleep your body truly needs. I want to know if you're still with me. If this is making sense or connecting with you, type 1 in the comments so I know you're following along. Now, let's talk about point number 4, poor sleep quality. I once met a man in his late 60s. He looked tired, pale, drained, and frustrated. "Doc," he said, "I fall asleep fine, but every night I wake up around 1 a.m. like a gun just went off. And then I just lie there, staring at the ceiling." We did all the tests. Everything looked normal. No sleep apnea, no medical red flags. But when I gently asked about his sex life, he looked away and said quietly, "That part of me is over, but maybe, just maybe, that part of him wasn't gone. Maybe it was the missing piece his body was craving." You see, sleep isn't just about lying still. It's a carefully balanced hormonal process. And one of nature's most powerful triggers for deep, restful sleep is something many people forget about as they age: orgasm. During orgasm, the body releases oxytocin, prolactin, and endorphins, natural chemicals that relax your mind and body. At the same time, your cortisol levels, the stress hormone, drop. Your breathing slows. Your heart rate evens out. Your muscles release tension. It's the perfect setup for deep, uninterrupted sleep. Now imagine cutting that process out of your life. Not once, but for weeks, months, or even years. That's what happens when older adults stop masturbating. The body loses one of its best tools for rest. And in its place, tossing, turning, frustration, and fatigue. Some people turn to sleeping pills. Others just accept being tired all the time. But here's the truth. Poor sleep does more than make you feel groggy. It weakens your immune system. It speeds up memory loss. It raises your risk of heart disease, anxiety, and depression. For older adults, it can also increase the risk of falls, forgetfulness, and even loss of independence. I've seen it happen. People who were once full of life slowly start withdrawing, not because of illness, but because they're simply too exhausted to keep going. And the saddest part? They didn't realize the thing they were missing wasn't medication or supplement. It was their body's own natural reset button. Masturbation may seem like a small or unimportant act, but for some, it's the difference between a broken 4 hours of sleep and a full 7 hours of deep, healing rest. One man told me after reconnecting with this part himself, "I sleep like I did 30 years ago. I didn't realize how much I needed that release. I just thought I was getting older." That's the problem. Too many people confuse neglecting their body with normal aging, and they suffer quietly, not knowing there's another way. If you find yourself lying awake at night, your thoughts racing, your muscles tense, and the hours crawling by, ask yourself, when was the last time your body truly relaxed? When was the last time you fully let go? Sometimes the answer is a new sleeping pill or meditation app. Sometimes your body just needs to reconnect with an old rhythm it hasn't felt in a long time, but still remembers. Now, losing sleep is one thing, but what happens next can be even more physical. You might start to notice your muscles weakening. Your balance becomes shaky. Your bladder starts acting up. Let's talk about what really happens to your pelvic floor and circulation when intimacy disappears. 5. Weakened pelvic floor and poor blood flow. A few years ago, I met a retired firefighter in his 70s, a strong man all his life. But now he was having trouble standing for long, and he mentioned some bladder leaks. "I don't get it," he said. "It feels like the base of my body is falling apart." He wasn't just aging. What he was describing was the slow weakening of his pelvic floor, a set of muscles most people never think about until things go wrong. These muscles support your bladder, bowels, and sexual organs. When they're weak, you may start to notice urine leaks or urges that come out of nowhere, trouble holding gas, back or hip pain when standing, even changes in sexual response. Here's the part people often don't realize. Sexual activity, even masturbation, helps keep those muscles strong. During arousal and orgasm, the pelvic floor contracts in a natural rhythm. That's a workout, not for looks, but for health. It improves blood circulation, keeps the tissues elastic, maintains nerve function, and strengthens the core muscles that support your body. When this activity stops, the consequences begin. Blood flow slows, muscles weaken, nerves go quiet, tissues lose strength and flexibility. For men, this can lead to sexual decline. For women, it can cause dryness, discomfort, and a lack of desire for intimacy altogether. I've seen older adults avoid social outings just because they're worried about bladder accidents. Others stay quiet, embarrassed by leaks when they cough or laugh. And most don't realize it's all connected to reduced circulation and muscle engagement in the pelvic area. Let me be clear. Ignoring this part of your body isn't just a small inconvenience. It can lead to falls, accidents, and a slow loss of confidence and independence. Suddenly, you're planning your outings around bathrooms. You're wearing pads or special clothing. You're adjusting your life for something that could have been prevented. And the longer it's ignored, the harder it is to fix. What hurts the most is that many people suffer in silence. They're too ashamed to ask questions. They think it's just old age. But here's the truth. Your body still wants to function, even at 70, 80, or beyond. And one of the most natural ways to support that is by staying connected to your body through safe, regular, intimate self-care. It's not just about pleasure. It's about strength, healing, and circulation. When you reconnect with that part of yourself, you're not just feeling good. You're keeping your lower body alive. You're protecting your independence. You're reminding your body it still matters. As serious as the physical effects are, the next consequence runs even deeper. It affects your immune system, your body's internal defense line, the part of you that fights off infections and helps you stay healthy. What happens inside your bloodstream after an orgasm might be one of the most powerful yet overlooked health benefits of all. Let's talk about how going without sexual release, yes, even solo, can quietly weaken your immunity. 6. Weaken immune function. A few winters ago, one of my older patients came in looking drained. He was in his late 60s and usually pretty healthy. But that year, he'd already been sick 3 times, with lingering colds and minor infections that just wouldn't go away. I used to bounce back in a day or 2, he told me. Now, even a little bug knocks me out for weeks. We checked all the usual causes, diet, sleep medications, but nothing stood out. So I gently asked him, "Have you been sexually active lately? Even by yourself?" He gave a small, embarrassed smile and said, "Nah, that part of me retired a while ago." What he didn't know, and what many people don't, is that sexual activity, including masturbation, has a direct effect on the immune system. This isn't just emotional, it's biological. During sexual arousal, and especially orgasm, your body releases a surge of helpful chemicals, not just feel-good ones like dopamine and oxytocin, but actual immune-boosting agents. One key example is immunoglobulin A IgA, an important antibody that defends your body against viruses and bacteria, especially in the lungs and gut. It spikes during sexual activity. So do endorphins, which help reduce inflammation and support healing. Now imagine your body going months or even years without that natural boost. Over time, your immune system loses one of its easiest, most effective supports. And at an age when your immunity is already slowing down, removing that support is like taking the batteries out of your smoke alarm. You may not notice right away, but when trouble comes, your body just doesn't respond like it used to. I've seen it many times. Patients who stopped all sexual activity start getting sick more often, heal more slowly, and struggle with chronic inflammation. They often don't connect the dots, but their bodies are speaking loud and clear. Something is missing. And it's not just about catching colds. Your immune system also helps prevent serious diseases, keep inflammation in check, support wound healing, and even monitor cancer cells. Regular sexual activity helps balance hormones, lower stress, improve blood flow, all of which are vital for strong immunity. When that part of your life disappears, a domino effect begins. Stress rises. Sleep gets worse. Inflammation builds. Your body slows down. One woman in her 70s shared that after losing her husband, she hadn't touched herself in almost 5 years. When I gently explained how intimacy, even with oneself, can boost immune health. She was hesitant but open. She gave it a try, not for desire, but for wellness. Months later, she came back with a smile, saying, "I can't fully explain it, but I feel more alive. My body feels like it's working with me again." That's not a miracle. That's what happens when your body gets the signals it needs. The signals that say, we're still here. We still want to live and thrive. It's easy to feel shy or dismissive about this topic. But guess what? Your immune system doesn't care about shame. It only cares about action. And sexual activity, even solo, is a powerful signal of strength, wellness, and life. But while a weak immune system puts your body at risk, there's one more consequence that cuts even deeper. It affects how you see yourself. Let's explore the final point, how ignoring your body can slowly erase your sense of identity and self-worth. When he came in for a routine appointment, I noticed something subtle but unmistakable had shifted. His posture was more slumped, his eyes dimmer. In the middle of our conversation, he sighed and said, "I don't really feel like I live in this body anymore. I just occupy it." That line stayed with me, because it's not rare. I've heard variations of it from both men and women. Different words, same truth. At some point, they stop feeling a home in their own bodies. And more often than not, that disconnection begins quietly, with silence, with the belief that physical self-connection is no longer necessary, that it's something outgrown or too late to reclaim. But here's what really happens when you stop engaging with your body in an intimate, attentive way. You begin to detach, slowly, subtly, and sometimes permanently. Self-touch isn't just about pleasure. It's about presence. When you connect with your body, even gently, with no agenda, you're telling your nervous system, "I'm still here. I still matter." That's not indulgent. That's essential. Without that, something inside starts to fade. You stop noticing the little aches. Stop looking in the mirror. Stop believing this chapter of life is worth investing in. And that loss, the loss of your own sense of value, is the most dangerous one of all. I've seen this kind of detachment spiral into emotional numbness, shame around aging, withdrawal from affection, even a decline in basic self-care. People stop exercising, stop eating well, stop dressing for themselves. One woman once told me she hadn't touched herself since menopause. "I stopped feeling like a woman," she said, "and the less I touched myself, the more I disappeared." That word, disappeared, hit hard, because it captures exactly what happens when people disengage from their physical selves. They lose more than sensation. They lose identity, visibility, vitality. But it doesn't have to be this way. Reclaiming your body through self-touch isn't about mimicking your 20s. It's about honoring who you are right now. It's a declaration. I still exist. I still feel. I still deserve to be seen by others and by myself. Even in private, even gently, reconnecting with your body begins to reverse the quiet erosion of self. You remind yourself that aging doesn't mean disappearing, that your worth isn't tied to youth. You return to yourself, and that may be the most healing act of all. Now, as we near the end of this conversation, let's pull everything together. Each of the consequences we've explored, emotional, physical, psychological, carries its own weight. But together, they tell a much larger story about what's really at stake. In all my years caring for older adults, what stands out isn't just the health concerns, but the invisible losses they often carry. Losses no blood test will reveal. A confident man who now avoids mirrors. A joyful woman who admits she hasn't felt anything in her body in years. And too often, they've been led to believe this is just part of aging. But I don't buy that. And if you're still here listening, I don't think you do either. Because here's the truth. When we abandon our sexual selves, when we stop tending to that part of our identity, a quiet chain reaction begins. We've talked about how it can affect prostate health, brain clarity, emotional balance, sleep, even immunity. But perhaps most deeply, it chips away at our sense of self. These aren't just side effects of getting older. They are your body's way of asking for your attention. I've sat across from people who felt broken, numb, lost. And I've witnessed the light return to their eyes as they began to reconnect with this part of their life. You don't need a partner. You don't need to be in perfect health. All it takes is your own permission to believe you are still worthy of care, affection, and presence. I know many people shy away from this topic. It's wrapped in stigma, silence, or shame. But I want you to hear this from someone who's walked this path with thousands of patients. Caring for your sexual health later in life is not indulgent. It's vital. Self-touch in older age isn't about indulgence. It's about circulation, hormonal balance, emotional grounding, and identity. It's not a luxury. It's a form of self-respect. A quiet but powerful way of saying, I am still alive, and I still belong to myself. One patient told me, I didn't realize how much I miss feeling like myself until I finally reconnected with that part of me. And that's really what this is about. Not just staying alive, but feeling alive. Not just aging, but inhabiting your years fully. So if you've forgotten this part of yourself, if you've tucked it away or labeled it as no longer relevant, I invite you to reconsider, to reconnect, to remember your body is still listening, still capable, still worthy. Start gently, start curiously, but most importantly, start because in caring for this part of yourself, you're not just nurturing your health, you're reclaiming your life. And if this message speaks to you, don't keep it in silence. Share it, talk about it, because your story, your voice, might help someone else remember they're still here too.